Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President, CEO of the National Black Leadership Commission on Health, formerly known as the National Black Leadership Commission on AIDS. And in 2019, after a 2-year rebranding process and 32 years of service to the African American community, the National Black Leadership Commission on AIDS in BLACA became known as the National Black Leadership Commission on Health, Black Health. Our mission is to champion promotion of health and prevention of diseases, to reduce disparities and achieve equity within the Black community. Our vision: to promote the health and wellness of Black communities through education, advocacy, and policy. Now, this is a major development, basically an organizational evolution that moved from HIV/AIDS to address multiple health issues and disparities disproportionately affecting African Americans. With a new mission, vision, Black Health expanded its health focus areas to include HIV, hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, and mental health, all of which affect African Americans at vastly disproportionate levels in comparison to other racial ethnic groups. And today, we will highlight the importance of health as a part of Women's History Month. We are so pleased to be able to be joined by one who has been very active in advocacy and education work through her lifetime, probably. And she is, of course, Maria Davis. While based in Harlem as a health advocate, she is known throughout the country and has devoted her life to improving the well-being of community members through the lens of health, promotion, and disease prevention. So, I welcome you.
Thank you, Ms. Fields.
And I will turn off my phone since it just went off. I'll turn it up. And I'm really pleased to have you, join us today because, as I said, we know that this is Women's History Month. And as I was coming in, I was reading a statement that I just wanted to share with you and our audience because it was in, I think, 1980 when then President Carter signed the first proclamation, even though Women's History Week had started sometime around 1978 to coincide with the International Women's History. Right. So, but he was the first president to actually sign a proclamation, and every president since then has signed a proclamation proclaiming Women's History Week and now Women's History Month. So this is what President Carter then said: "From the first settlers who came to our shores, men and women have worked together to build the nation. Too often the women are unsung, and sometimes their contributions went unnoticed. But the achievements, leadership, courage, strength, and love of the women who built America was as vital as that of the men whose names we know as well." Absolutely. Now that's what President Carter said back in 1980. And when we look at women, especially Black women,
yes,
in terms of unsung heroes and the work that Black women have led on and have done and made a difference for years, celebration of Women's History Month really is just another month for us to do what we always do,
Absolutely.
365, right?
Absolutely.
Giving our women their flowers while they can see them, smell them. And I think that is one of the most magnificent ways that we can really, emphasize, highlight, promote contribution. So
Absolutely.
your being here today is very special.
Thank you.
I happen to know a lot about your history, your journey, and the fact that you're continuing to do such good work. So let's just talk about what you're doing as an advocate, not only in health, but also your community, because I know what you do in the village of Harlem. I see it, I see you out there, and I know how active you are. So talk to us a little about what your journey has been and how did you come to the point of wanting to be such a voice and an advocate for women, for health care, and your community?
Well, it was a long journey. I mean, I've always been involved, even in high school. I'd make people laugh because my job in our club was to give people who were sick, send them get well cards. So I've always cared and I always had compassion for people that were, struggling in their health. And at that time, I was only about 14, 15 years old. And then, my health took a turn in 1995. I found out I was HIV positive. And then 3 years later, by 1998, I was diagnosed with AIDS. I found out through a life insurance policy. And that was a long struggle getting my health back. But I also was a promoter in the music industry too. I have a showcase called Mad Wednesdays that I still do till today at the Shrine in Harlem. And I was doing the showcases, and I always thought that the showcases was to really promote me as a promoter and have me amongst big celebrities, from Jay-Z to Puff Daddy to anybody you could think of, grace the stages. But God was really setting me up for the stage of HIV and AIDS first, and then to also understand that HIV and AIDS was not in a vacuum, that it was connected to so many different other things, people's education, people that low income housing, and resources and opportunities that were not giving to people of color that might not have been on the higher echelon of the income. Right. And so as somebody who could not work, I understood for a while, did not understand, but then had to understand the mission. And once I became well, and the most important thing, I had so many medical people educate me. So at the time, when I first got diagnosed, I had Dr. Mack. Dr. Mack was not an infectious disease doctor. So I had to, at the NYC Center.
Yeah, I remember Dr. Mack.
Yes, and that was on 97th Street. And then I had to leave her and go to another doctor who was kind of understood infectious disease, but then wound up with Dr. Joseph Sonabin. He was out of England, and he taught me so much information. He was a white man. And it was so funny because I remember when they kept saying, you have to see a doctor that really understands it. He was treating gay white men at the time. And they were saying, oh, you got to see Dr. Joseph Sonabin, because at that time he was doing private practice, but then he went into the community and started working in the clinic, Cabrini Clinic, that is no longer with us, and Cabrini Hospital that I had to stay at a couple of times. He educated me, and the hunger, seeing Deborah Fraser Hauser on TV, because that's when I got introduced to the National Black Leadership Commission on AIDS, and seeing her and saying, oh, I got to tell that lady my story. I have to tell that lady my story. And then, meeting all people that were in the music industry had then become people working in the community-based organizations like Deborah Levine and Eddie at the time. They were all frequenting my parties. And then I had to let them know that I was HIV positive and now living with AIDS. So it was a journey, but I tell people sometimes, they ask me, well, how do you think your life is with AIDS? And I said, much better.
And partly because of what you decided to do, not only seek the information for yourself in terms of medical care, but also get involved with the organizations like the National Black Leadership Commission on AIDS. And I know that that also enabled you to expand and be able to meet a lot of other people in the field who were doing the work. And of course, today you've continued to be an ambassador for health disparities in general. Of course, we know the intersectionality of HIV/AIDS and these other diseases, but not just HIV, but talking to women about breast cancer, about diabetes,
cervical cancer,
and working in the community to make sure that that information gets around. And I know you do a lot of work with faith-based organizations.
Yes.
Talk some about why do you think, or what do you think, not why, but what do you think maybe they could and should be doing more now to increase their presence and be more of a voice, as we know many of them were during the civil rights movement.
Absolutely.
And leaders, but we don't quite hear them as many voices now as we have in the past. So since you work so much with faith-based organizations, what's your take on some of that?
Well, you know, I had the opportunity to work with Y.T. Walker at Canaan.
The man, right.
When I first was diagnosed with HIV. And he really inspired me and let me know that you are not your diagnosis. And he really supported the work. I was doing the AIDS walk. I was doing the Boston to New York and New York to Boston AIDS ride. And he really, really ignited that. And then I went over to First Corinthian Baptist Church in Harlem, Michael A. Wallen and Reverend Lakeisha. And it was like he was the continuation, because then Y.T. Walker became sick.
Right.
And the reason why the church is so important, first to me, is because that's how we communicated when we were brought over from the shores into America. And the church was major in us getting our messages out to each other, in us meeting. You know, they thought we were so unintelligent that they did not know that although we couldn't communicate with them, we communicated with each other. So the church was very important. Martin Luther King, you know, very important. Malcolm X, very important. But Martin Luther King did a great thing, because wherever he had meetings and they strategized, it was in the church or something that was part of the church. And so those voices was heard very loudly. And I don't know if it's the money, I don't know, you know, what it is. You know, the church has changed a little bit. You know, we have mega churches now. We have big, huge churches. To me, the churches that did the most work was the little churches. I'm sorry I have to say that. I do a lot of work with the little churches. But, you know, it is important. I am very fortunate that at First Corinthian Baptist Church, they allow me to do basically anything I want to do with health. And they are a very active church. But I tried, from partnering with Black Health and getting a lot of resources and information to people that other people don't have, and meeting people in the medical field and in the cancer field that other people don't have privy to have. That's how I'm able to help other churches. And I'm a mentor, of course, at Black Health. So I mentor my churches in Staten Island and mentor my churches in Queens. But Black Health has been so intricate, because this is not only during HIV, but during COVID.
That's just what I was going to ask you about,
During
because I
COVID.
remember that when so many people were still behind closed doors. Fortunately, we had teams, including yourself, of people who were willing and wanted to be out there to pass out information. And you know that passing out, even while we were, you know, scheduling people to get vaccinated and to call you, and you had a whole list of people to put on that schedule.
Yes.
That really was magical.
Yes.
I describe it that way, because there were so many barriers and people could not get information.
Couldn't log on. The seniors couldn't log on.
Exactly.
And get appointments. When you went in to get an appointment, the appointment was gone.
Right.
So Black Health called me up and said, we have some appointments. I was like, what? And once I got one senior, I became the hottest item
Exactly.
in the community. And not only seniors, but everybody was calling. We heard you can get us an appointment. Pastor, Reverend Keisha. When we started doing the boosters.
Yes.
We went crazy. I
vaccinations.
was doing Booster Saturdays
Yes.
with Black Health.
I
And then on
remember.
Saturdays, people would come. I did it on a Saturday because nobody had to work or people didn't have to work, but it was easier for them to come and get their boosters on Saturday. So
Oh no, you were very valuable before as well as then, especially as you said with the vaccination, getting people on the schedules, because even when they tried to go through the pharmacy,
yes,
they were not able to get an appointment. And so to be able to schedule people and get them a place in that line and make sure that they got vaccinated, it was magical.
It was
and
very
people
magical.
remember that very
Yes,
much.
yes.
So you have been doing this work. So I guess one of the questions that I guess I would like for you to focus on is that with everything that you've done and continue to do, what is your message to younger people to get them more engaged at the community level, whether it is advocating for changes in their block, on their in their building, their schools, education, or even becoming interested in public health? What are some of your thoughts or recommendations about engaging the younger generation?
you know, Mad Wednesdays is such an opportunity showcasing. I still showcase a lot of young people. And in there I do HIV testing and Hep C. And Kimar used to do it all the time for me in the shrine. And you know, that's unconventional for you to come into a club, you see in a showcase, you might be having a little cocktail, whichever kind of cocktail it is. And then I come up to you, Kimar and them did a great job outside, but come up to you and say, you need to get tested. And they trusted me. So they would get, okay, Ms. Davis, whatever you want, Ms. Davis. But there's so many distractions now, you know, social media and, you know, we coming up on election year now, and it's that's a whole nother show you have to do. And really people getting civically engaged, but the most important thing is that they see you show up. That's the most important thing. You can't talk to somebody about doing something that you're not doing. So I get many calls from young people. How can we help? What can we do? We see you out there. How can we do the same thing? And I don't want anybody to be like me, because people always say, I want to be like you. No, be like yourself. Have compassion, love. We are each other's keepers. If I'm not doing okay, you're not doing okay. If you're not doing okay, I'm not doing okay. For my children, for my grandchildren, for my community, because a healthy, not only me being healthy, but a healthy me and getting out there and giving information is a healthy community. And
a healthy community is a livable community.
A livable community.
Say.
And that is so important for us to be out there and for us to show up. And education starts with you. Whatever you're going through, whether it's high blood pressure, whether it's diabetes, whatever it is, get educated about it. And if it's somebody in your family, get educated about it and then help them. And then when you help them, they'll help someone else and they'll help someone else. But we have to, nobody can sit on the sidelines anymore and say, I don't want to participate. You have to participate. It's imperative that you, life and death, that we participate. We saw it through COVID. Many people did not even know they had health disparities until COVID came along and said, oh, hi, you have heart trouble? You have high blood pressure? You got high cholesterol? Well, I want you, like Uncle Sam. And that's when it, very unfortunate, but a lot of African Americans died. And you know, COVID was in 2020, but people are still not taking care of their health. And we have to sound that alarm. It is about you are important. You are important. When you have children, when you have family members, you are important. Take care of you, and then you're able to take care of other people.
Well, one of the things I think I know you experience, and Black Health, I hear it and I see it, where there's such burnout from people who've been involved in it, and they are feeling like, you know, they just don't want to be doing that kind of work. Advocacy, which is an education, which we know is very much needed. But the needs continue, and we've got to figure out how to work more with the next generation to help them understand what you just said. They can make a difference, but they've got to be in it and willing to learn, to listen, to grow, and take advantage of the opportunities that are being, given them. And that's not I'm not seeing that as much as I would like to, even in some of our schools. Black Health used to do work in schools. We're not in the schools as much now as I would like to see us in the schools, because, interacting with students in their space is also very important. But
well,
we're not
y'all
in the
have
schools.
a program called YAI too. Right. And where the churches, certain churches submit young people to be able to take a certain amount of weeks, a couple of week program, 6-week program, where y'all teach them about health and everything. I mean, that's where it starts. Do we need more YAIs? Yes, we sure do. We need a whole lot more. But the focus is not health anymore. The focus is the latest song. The focus is the latest clothes. The focus is, the latest sneakers. What sneakers do you have? Yeah. And I think it is important for the leadership. We got a lot of athletes, and we have a lot of entertainers making a lot of money. And to me, I am sounding the charge that your family's good, but your family ain't the only family living on this earth. Right. And your children might interact with my children. And if your children are doing well, then you should be interacting so someone else's children can do well too. So I think too, it is a lot of entertainers that need to be really bringing this message out here, how important health education is, how important self-education is, and not emphasizing so much on money and the materialistic things. The outside you can dress the outside up all day, but if the inside ain't well, being dressed up out the outside doesn't even matter.
Oh, you're absolutely right. I think we are beginning to see some more movement of entertainers. Like, for example, I don't know if you got a chance to watch the recent NAACP Image Award, where Usher received the President Award. And he was fabulous in terms of his comments and all that he's doing, certainly to work with youth and so forth. And as you talked about the Black Health Youth Program, last year I think it was, Melissa expanded that, and we're looking to continue to do that, to do more around advocacy, to expose young people to advocacy, how to advocate, as I said, for changes, whether it's on your block, in your school, or in your community. And to be able, there were programs, and I'm sure you're aware of some of them, where they were able to go to either the state capitol or New York City and really do mock performances as council members. And we've seen young people grow through that, and I've certainly seen some of them deciding to run for public office from some of those early experiences. So I think a lot of that is what we need to get back to, because when we think about things that worked and the differences it made in lives, yours, mine, and others, that those were not bad things. They were very helpful things. And now, without the families being as connected as perhaps they were early on too, so that you knew if you needed something, your family would help you with that. And if you lived on a block and they saw you acting out, your mother or father or somebody
knew
would get it before you even got back home, right?
Absolutely.
So I understand that, and I think that you continue to certainly be a model for carrying that message through, Maria. And we're just so very pleased that you've continued to be an ambassador with Black Health and being able to share your experiences. So in the last minute or so that we have, is there anything you would like to share about doing advocacy work and making a difference as you continue to do?
We have to make sure that people have hope, that people are hopeful, and that they feel loved, And I mean, this is, to me, that is the biggest message that we need to give. Hope and love, and that we care about each other, and that I want to see you do well, and I want to do well also. But we have to really love, 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 love.
And that is so important, and we do love you. So thank you
too.
so much, Maria. And Ms. Davis, I thank you for joining us. Your life's work highlights the importance of women in advocacy by educating our communities on best practices to prevent the onset of diseases. We can work toward eradicating health disparities that disproportionately impact Black women and Black America. Referencing your journey, we can join the efforts of health advocates across the country who have devoted their lives toward improving the health and well-being of fellow community members. So for more information about Black health, our organization, visit our website at nblch.org or look for us on Facebook, Twitter, Instagram, LinkedIn, and YouTube. And the Manhattan Neighborhood Network brings these programs to you to better inform you, the viewer, about the important topics that impact our health and well-being. So please let your family, friends, and neighbors know about this programming. And I am C. Virginia Fields, thanking you for joining us, and hope you'll tune in next time for Health Action TV here on Manhattan Neighborhood Network.